dentists can treat obstructive sleep apnea with an oral appliance. But first, let's ask ourselves, who is a candidate for an oral appliance? So there's a couple of considerations to look at here. One is you want to evaluate the patient's severity. If they're a severe sleep apneic and they have not tried CPAP, my general rule of thumb is that they're not a candidate. They need to try a CPAP first. Some patients are going to refuse. If they do, I will have them sign an affidavit and I will treat that patient. Another reason that a patient might not be a candidate for an oral appliance is if they have insufficient teeth for retention. If a patient comes in missing all of their molars and their premolars and they have anterior canine to canine on the upper and lower, that patient might not be as great of a candidate for an oral appliance. I have treated completely edentulous patients. Usually the dentures are implant retained to a certain degree. If you create retention on the denture, you can actually pop the denture off. And so for a patient who's completely edentulous, they're not a great candidate for an oral appliance. If they've tried CPAP and they've failed CPAP, I will attempt to treat that patient. You just want to be able to communicate the patient's expectations at the beginning in terms of what to expect at nighttime. Another reason that a patient might not be a great candidate for an oral appliance is rampant decay or perio disease. For a patient who has rampant decay, they have an airway issue that could kill them in their sleep. So we want to identify and treat that, but part of our treatment plan also is going to include a dental treatment plan. We want to get the teeth healthy again, possibly do gum therapy if they have periodontal disease, and then treat them simultaneously. So that's really important to evaluate that. At the initial clinical examination, I'm looking at a couple of factors evaluating the patient's candidacy for an oral appliance. Just because they hit one of these markers doesn't mean that they're not a candidate. It just changes the conversation that I have with that patient at that consultation appointment. The first thing that I'm looking for, as mentioned, is their perio status. Have they ever had a deep cleaning? Are there pockets involved? If so, that's part of my recommendation. Doesn't mean they're not a candidacy. I actually have that in the informed consent that if you have perio disease, it's possible the appliance could affect that negatively and we want to recommend treatment. The second thing that I'm looking for is the TMJ status. Is there any current TMD situation that we need to be able to manage with the appliance? A great question that I ask patients is, has your jaw ever clicked or popped before? Even as a teenager. If the answer is yes, the next question that I ask is, does it still click or pop? And if the answer is no, then it's possible the disc is displacing and it's not reducing back. When I put them in an appliance, it's possible that clicking and popping can return. So I want to educate the patient on that. You also want to document these findings in your initial appointment notes. Some insurance plans are going to require you to do this. In fact, if you don't, your claim could get denied. So we notify in our notes perio condition, we notify TMJ status, and in that category, we're also doing some type of range of motion exercise. What type of range of motion do they have? Is it adequate? Is there limited opening? So all that goes in our documents, which we send into insurance. Another item that we document is the amount of retention we should expect from the oral appliance. In other words, how many teeth does the patient have? So some insurance plans are going to require a minimum number of teeth. As a general rule, we're going to shoot for 8. So in my clinical notes, I'm saying there is sufficient retention for the oral appliance. So you want to document all that. You want to educate your patient. A lot of our communication with patients needs to happen that first appointment. If we're communicating the possible side effects that can happen, it helps us manage those side effects if they happen.